What if your body has already been warning you about diabetes and you've been dismissing it every single day? Before any blood test, before any diagnosis, the signs may already be visible right on your feet. And what I'm about to share today could change how you see your own health forever. Most people believe diabetes can only be caught through a lab result. You go to your doctor, the blood work comes back, and that's when you find out. I understand why people think that. For years, that's exactly what my patients told me too. But here's the truth. Your body starts warning you about high blood sugar long before any lab result ever would. And the very first place it speaks, your feet. I'm Dr. Sarah Ellison, and I've spent over a decade as a practicing physician helping seniors identify the silent warning signs their bodies send before a crisis hits. In that time, I've seen something that genuinely troubles me, patients who had every warning. Signed for months, sometimes years, and never knew what they were looking at. They explained it away. They assumed it was age. Today, I'm going to make sure that doesn't happen to you. Just a few months ago, I sat with a patient, a 64-year-old retired teacher, active, felt completely fine. She came in for a routine visit and almost as an afterthought mentioned her feet had been feeling a little numb lately, a little tingly at night. She said, "Dr. Ellison, I figured it was just age catching up with me." Before we even touched her blood work, I asked her more about her feet. She had 4 of the 9 signs I'm going to walk you through today, already present, already speaking. She just didn't know the language. Her fasting blood sugar came back at 219. She had been diabetic for nearly 2 years without knowing it. I want to show you exactly what I showed her. 9 signs already on millions of feet right now that almost nobody recognizes for what they are. For each one, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit that can protect you. The American Diabetes Association estimates 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people with a silent condition quietly damaging their nerves, kidneys, vision, and yes, their feet. A blood glucose test costs about $12 and is covered by Medicare for most of you. But first, you need to know what to look for. So let's get into it. Sign number 1 is something almost every patient has already experienced, and every single one of them has explained away. Tingling, numbness, that pins and needles feeling in the feet. My patients almost always say, "Dr. Ellison, my foot just falls asleep sometimes. I was sitting with my legs crossed." And yes, that happens to everyone occasionally. But I always ask, is this happening regularly without a clear reason? Because if the answer is yes, we need to talk about what's actually going on. Frequent, recurring tingling or numbness in the feet, what doctors call peripheral neuropathy, is one of the earliest signs that blood sugar has been elevated for some time. The excess sugar in your bloodstream begins attacking the protective coating surrounding your nerves. It's a slow process, which is exactly why most people miss it. Think of your nerves like electrical cables. Every cable has a protective coating that allows signals to travel cleanly from your brain to your feet. When blood sugar stays high, it acts like a slow acid eating through that coating. The cable still works for a while, but the signals start getting fuzzy. That fuzziness is the tingling you feel. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes. It is the single most common complication, and it almost always starts in the feet. My daily recommendation: a 20 to 30-minute walk every day. Not a jog, a walk. Movement keeps blood flowing to your feet and protects those nerve endings. And start reducing added sugar in your diet today, not next month. Today. Sign number 2 is the one my patients describe as the most distressing because it doesn't hit them during the day. It hits them at night when everything is quiet and there is nothing to distract from it. Burning feet. A deep, uncomfortable heat rising from the soles, specifically when lying down trying to sleep. Most people chalk it up to tired feet, warm weather, or a long day on their feet. And sometimes that's all it is. But when a patient tells me their feet feel like they're on fire at night, when they're resting, when nothing should be causing that sensation, I take it very seriously. Burning in the soles at night is a classic early sign of diabetic neuropathy. The nerves in your feet have been damaged by excess sugar and are now sending incorrect signals to your brain. Your brain receives a heat message even though nothing hot is touching your foot. The nerves are misfiring. Think of it like a smoke detector with a broken sensor. The room isn't on fire, but the alarm keeps going off because the sensor itself is damaged. That's exactly what's happening. The burning isn't coming from outside. It's coming from damaged nerve tissue crying out for help. Research in the journal Diabetes Care found that burning foot pain is one of the first symptoms reported by patients later diagnosed with type 2 diabetes, often appearing 1 to 3 years before any formal diagnosis. 2 habits I recommend. First, drink at least 8 glasses of water daily. Proper hydration helps your kidneys flush excess glucose and supports nerve tissue. Second, add fiber to every meal. Vegetables, legumes, oats. Fiber slows sugar absorption, which is exactly what those damaged nerves need right now. Sign number 3, pay very close attention here, because this is where things stop being uncomfortable and start becoming genuinely dangerous. This is the sign that sends the most patients to the emergency room. They come in and say, "Dr. Ellison, I had a small blister from my shoe about 3 weeks ago. It still hasn't healed." They waited. They assumed it would close on its own. Most small wounds do heal on their own, but not when blood sugar is elevated. When blood glucose stays consistently high, your body loses its ability to heal efficiently. The tiny blood vessels in your feet begin to narrow and stiffen. Oxygen, white blood cells, and the nutrients needed to repair tissue simply cannot reach the wound fast enough. It stays open, vulnerable, and waiting. Imagine trying to water a garden with a severely kinked hose. The water exists, it's just not getting through. That's what high blood sugar does to circulation in your feet. The healing ingredients are in your blood. They just can't reach the wound. The CDC reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, over 100,000 every year. Almost all of them began as a small wound someone decided to wait on. Tonight after your shower, examine both feet carefully. Look between every toe, check your heels. If you find any cut, blister, or broken skin, clean it, apply antiseptic, and cover it. If it hasn't improved in 48 hours, call your doctor. Not next week. 48 hours. Sign number 4 is hiding in plain sight. It's been visible. It's been there. And almost nobody connects it to blood sugar. Patients notice their ankles or feet looking darker, reddish, or with a slight bluish tint and tell me, "I think it's sun damage," or "I've always had darker skin there." That may be true, but there is a specific pattern of discoloration around the ankles that I look for when assessing blood sugar risk. When circulation is compromised by high blood sugar, the lower legs and feet stop receiving enough fresh oxygenated blood. The skin changes color in response. In some patients, it also becomes thinner and more fragile, a sign the tissue underneath isn't being properly nourished. Think of your blood as a delivery system bringing oxygen and nutrients to every part of your body. Your feet sit at the very end of the longest route, farther from your heart than anywhere else. When the roads narrow from blood vessel damage, deliveries stop arriving. The skin, starved of oxygen, signals its distress through color. It's been there all along, you just need to know what you're looking at. A study in the Journal of the American Academy of Dermatology found these skin changes are detectable on average 18 months before a formal diabetes diagnosis. 18 months of warning right there on your ankles. 5 minutes of ankle circles, toe raises, and calf stretches every morning gets blood moving into your feet. And if mobility is limited, simply elevating your feet slightly while you sit makes a real difference throughout the day. Sign number 5 surprises my patients the most because it looks completely harmless. Most people have lived with it for years and never connected it to anything serious. Dr. Ellison, my heels crack every winter. It's just dry skin. I hear this constantly. And yes, seasonal heel cracking is common. But when heels are cracking badly in the middle of summer or when lotion hasn't helped no matter how faithfully you've applied it, that's a completely different story. That's your body telling you something no moisturizer can fix. Diabetes affects the autonomic nerves, the ones controlling automatic body functions you never think about. One of those functions is regulating moisture in the skin of your feet. When these nerves are damaged, the sweat glands in your feet stop working properly. Your feet lose natural moisture from the inside out. No amount of cream addresses that root cause. Think of your skin like a sealed wall. When the autonomic nerves fail, the mortar between the bricks crumbles. Cracks appear. And those cracks aren't cosmetic, they're open entry points for bacteria. In a foot with poor circulation, that infection can become serious very quickly. The American Podiatric Medical Association identifies chronic, treatment-resistant heel cracking as a significant indicator of autonomic neuropathy in seniors, directly linked to prolonged elevated blood sugar. Moisturize your feet every night before bed, a good lotion or pure coconut oil applied to the sole and heel. But never between the toes. Trapped moisture breeds fungal infection. And keep drinking 8 glasses of water daily. Your skin needs hydration from the inside as much as the outside. Before we go further, I want to pause and ask you something directly. Have you noticed any of these signs in yourself or in someone you love? A spouse, a parent, a sibling? If the answer is yes, even one sign, go to the comments right now and type yes. Just that. Capital letters. I read every single comment on this channel. If you have a question, ask it. If you're concerned, tell me. That's exactly why I created this channel, not to talk at you, but to talk with you. And if this video is giving you information you needed, hit the like button right now. It takes 1 second, and it helps YouTube show this to more seniors who need it. You could genuinely help someone today just by pressing that button. Let's keep going. The next 4 signs are ones you cannot afford to miss. Sign number 6 is more serious than most people realize because it isn't only telling you something about your feet. It's telling you something about your kidneys at the same time. Almost every patient I've seen with this has a ready explanation. I'm on my feet all day. I sit at a desk for hours. Occasional swelling from activity is completely normal. I want to be clear about that. But if your feet and ankles are consistently swollen, if you press a finger into the skin and the indentation stays for several seconds, if your socks are leaving deep marks every evening, that changes the picture entirely. High blood sugar gradually damages the kidneys, and the kidneys control your body's fluid balance. When kidney function is impaired by years of elevated glucose, fluid accumulates and pools in the lowest part of your body, your feet and ankles. Doctors call this pitting edema, and it is a visible sign that your body's filtration system is under real stress. Think of your kidneys as the filtration plant for your entire body. When high blood sugar damages those filters, the system backs up. Excess fluid has nowhere to go but down. Gravity does the rest. The National Kidney Foundation reports diabetic kidney disease affects 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible sign kidney function is already being compromised. When resting, elevate your feet above your heart level. Even a few inches on a pillow helps move fluid back toward the center of your body. And reduce sodium in your diet. Salt causes water retention, which makes edema significantly worse. If the swelling is new, persistent, or worsening, bring it to your doctor at your very next appointment. Don't wait on this one. Sign number 7 is the one I see misdiagnosed most often. And by the time patients learn what it actually is, they've been masking it for years. I've been taking ibuprofen for foot pain for months. I figured it was arthritis, maybe an old injury. I've heard this dozens of times. And sometimes that's exactly right. But sometimes the pain has a completely different origin, one that ibuprofen will never touch, because this isn't inflammation. This is happening inside the nerve tissue itself. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they become hyperactive, firing intense random signals the brain interprets as severe pain. Stabbing. Electric. Like a hot needle through the foot. It happens most often at night when there are no other sensory distractions. Think of a car alarm damaged in a minor accident, screaming every few minutes for no reason, because the sensor is broken. That's exactly what a damaged nerve does. It sends alarm signals to your brain when nothing is actually wrong. The pain is completely real, but its source is nerve dysfunction, not injury. And taking ibuprofen doesn't fix a damaged nerve. It only silences a signal your body is desperately trying to send you. A landmark study in the New England Journal of Medicine found painful diabetic neuropathy affects approximately 25% of people with diabetes and is routinely mistaken for arthritis or age-related joint pain. Every morning before getting out of bed, spend 5 minutes doing gentle foot and ankle stretches. Flex your feet, circle your ankles, pull your toes back gently. Get blood moving before putting weight on your feet. And every night, give your feet a gentle 3-minute massage, light circular strokes along the sole and up toward the ankle. Small habit, real results over time. Sign number 8 tells me, as a physician, how far things have already progressed. When I see this in a patient, I know we are not in early territory anymore. And almost every time, patients laugh it off before I can even finish asking. Dr. Ellison, I've always had cold feet. My husband's been stealing the heated blanket from me for 20 years. That's just how I am. I understand that. Cold feet are so common people genuinely believe it's simply their body's personality. But then I ask, are your feet cold in July? Cold under 3 blankets when the rest of your body is perfectly warm? Because that is a different conversation entirely. Feet that are persistently cold, regardless of the temperature around them, signal that warm, oxygenated blood is no longer reaching your extremities in sufficient volume. Your blood vessels have narrowed or stiffened to the point where circulation simply isn't completing the full journey down to your feet. Think of blood vessels like heating pipes running to every room in a house. When those pipes narrow from years of damage, the heat can't reach the far end. The room stays cold no matter how hard the furnace works. That coldness isn't about the weather, it's about the pipes. The American Heart Association identifies peripheral artery disease caused by this exact blood vessel narrowing as affecting over 8 million Americans, with diabetes as the single largest risk factor. Persistently cold feet are one of its earliest and most consistent symptoms. The most effective daily response is a 30-minute brisk walk, purposeful, arms moving, intentional. This forces circulation into the lower legs and feet and strengthens blood vessel walls. Start with 10 minutes if 30 feels like too much. Just start. Starting today matters more than starting perfectly. Sign number 9, and this is the one almost nobody ever talks about. I've never seen it in a patient brochure. Most people walk past it on their own body every single day without noticing. But once you see it, you'll never unsee it. During a foot exam, I sometimes notice something absent on a patient's lower legs and the tops of their feet. Not something unusual, something missing. Hair, or rather, the noticeable lack of it in areas where it should naturally be. When I point it out, patients look down with genuine surprise. I never even noticed that. And that is exactly the problem. Hair follicles need a steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, follicles in the feet and lower legs gradually stop receiving what they need. Over time, they stop producing hair entirely. That absence of hair is a visible marker of blood vessel damage that's been building, in many cases, for years. Think of hair follicles like plants in a garden fed by an irrigation system. When the pipes narrow, the plants don't die immediately. They just gradually stop growing. The garden gets thinner, quieter, until one day you notice almost nothing is left. That thinning is your body showing you on the outside what's been happening to your blood vessels on the inside. Research published in Diabetes, Obesity, and Metabolism found that lower extremity hair loss correlates significantly with peripheral vascular disease in diabetic patients, a reliable, frequently overlooked clinical sign that physicians are specifically trained to check for, but that rarely gets communicated to patients themselves. Right after this video, look at your lower legs and the tops of your feet. If the hair is noticeably thinner or absent in patches, schedule a blood glucose test this week. Not this month, this week. $12 at any certified lab, covered by Medicare for most of you. That simple test could change the entire direction of your health. 9 signs. 9 chances to catch something before it catches you. One of the hardest moments in my work is sitting across from a patient who has had every single one of these signs for 2 years and is only now finding out what they meant. Not because they didn't care, they cared deeply. They simply didn't have the information. You now have it. Tonight, before bed, sit down and look at your feet. 30 seconds. Check the skin. Look between the toes. Feel for numbness. Look for any wound that shouldn't be there. And if you recognize anything from this list, call your doctor tomorrow morning. Not next week. Tomorrow. Because caught early, this is manageable. In most cases, through a change in diet, a daily walk, and one honest conversation with your physician. You've worked hard for your independence, your health, your ability to do what you love. Don't let something as manageable as blood sugar quietly take any of that from you, simply because nobody told you what to look for. Now you know. And if you want more conversations like this one, I post a new video every day, topics that matter for your health after 60. Subscribe and bring someone you love along with you. I'm Dr. Sarah Ellison, and I'll see you in the next one.